exhausted, breaking out, hair growing in places where you don't want it, irregular periods, heavy bleeding, mood swings that don't really make sense. If these things sound familiar to you, it might be PCOS, polycystic ovary syndrome. It affects up to 1 in 10 people who have ovaries. And yet most people who have it, it goes undiagnosed for years, gets brushed off as just stress or just how our bodies work, right? And it's not. It is a hormonal condition, and it disrupts how your ovaries actually function. And one of the hallmark issues is that your body starts producing higher than normal levels of androgens, which like male hormones, and that can lead to a storm of symptoms. Irregular missing periods, excessive facial or body hair, deep fatigue, stubborn weight gain, cystic acne, even like hair thinning. And it's systemic. It's not just like cosmetic things. PCOS is a leading cause of infertility as well. So it doesn't mean you can't get pregnant, but it might mean that your body is not ovulating regularly, which can make it harder to conceive if and when you're ready. But PCOS isn't just about reproduction either. It just affects your entire life. It's been linked to an increased risk of depression, anxiety, even insulin resistance, sleep disorders. So that kind of whole body disruption, it really deserves to be taken seriously. So how do you know if you have it? Your doctor will likely run a panel of blood tests to check your hormone levels. They're going to ask you about your symptoms, obviously. They may even order a pelvic ultrasound to look for cysts, and they're going to take in a full history. Everything from your period patterns to your skin to your mood. And diagnosis is not just like one symptom, it is a puzzle that they have to put together with patterns. And there isn't a cure, but there are ways to manage it. So hormonal birth control is often one of the methods that can help regulate your cycles and lower those androgen levels. Dietary changes sometimes, especially reducing added sugar, can help improve some symptoms. Your typical things like exercise, trying to help you sleep better, stress management, sometimes insulin meds like metformin can help and are often prescribed. So it's very personalized depending on what you are dealing with. Many people who have PCOS, they get misdiagnosed with depression or even like IBS, or just told that it's just like part of your body management, right? Because the condition does present differently with different people, it can be complicated or hard to diagnose. You can be thin and have PCOS. You can have regular periods and have PCOS. So the stereotypes, they just miss a lot. So if you've been feeling like your body is not working right and no one is listening, maybe go in and just directly ask your doctor to test you for PCOS. I'm not here to diagnose anybody. I just want people, just encouraging people to advocate for themselves if they feel like something is wrong. And so if you already have been diagnosed and you have PCOS, what is something you wish people understood about living with it? What have been your struggles and what has helped? Let me know in the comments.